Good morning, good afternoon, good evening, everyone. I'm Professor Rashid Ansumana, presenting on behalf of the WOW Consortium. I'm presenting the West Africa One Health Actions for Understanding, Preventing, and Mitigating Outbreaks. The abridged name of our consortium is West African One Health, with the logo shown on the slide. And this is the outline of my presentation today. The project locations for our consortium are Nigeria, Liberia, Guinea, and Sierra Leone, as you can see on the map. And in each country, the locations where we are doing data collection are the ones highlighted in the country maps shown on the slide. The country PIs for this consortium are as listed on the slide. We have Dr. Nfale Magasuba in Guinea. We have Dr. Julius Gilayeni in Liberia, and Professor Simeon I.B. Kadmos in Nigeria, and myself, Professor Rashid Ansumana in Sierra Leone. The consortium membership is also as shown on the slide, with partners from West Africa, and also we have at least 3 partners from across UK and Australia. You can see the Royal Veterinary College in UK, the Australian National University, and the London School of Hygiene and Tropical Medicine, in addition to the West African organizations listed. As a background, increased anthropogenic activities have increased the possibility for multi-species contact and change host pathogen dynamics, infection epidemiologies, increasing risk of zoonosis, and emergence of novel pathogens. Ebola virus disease, Lassa fever have created serious challenges in West Africa, and their recurrence coupled with COVID-19 pandemic and associated economic woes have posed and tend to further pose multifaceted threats in the region. The objectives for our work are listed in the slide shown here. We are set to assess the relationship between changing demographics, gender equity, land use change, and emerging diseases in West Africa using gender-sensitive socio-ecological systems research. And secondly, we also are investigating the impact of Ebola virus disease, Lassa fever, and COVID-19 on access to health for humans and animals, environmental health, livestock, food security, and socio-cultural practices by exploring the effect on gender equality and determining innovative approaches to improve gender equality. And thirdly, we are also set to develop and improve using gender mainstreaming community action groups for community participatory animal disease surveillance, community participatory human disease surveillance, and then finally, we also are exploring zooanthroponosis or reverse zoonosis and COVID-19 infected rural and urban West African communities. But because COVID-19 is waning, so we'll be looking at opportunistic infections, but using the reverse zoonosis approach. The slide shown here now gives you an overview of the entire project. We have the work package 1 for coordination and work package 2, which is social ecology, pathogen surveillance, and land use analysis shown at the bottom of the slide. We also have work package 3, which is a reverse zoonosis work package, and then work package 4, community action networks, and work package 5, policy and systems, work package 6, gender integration. The locations in each country where we are working, shown on the map shown earlier, are also listed against the countries that are named on this view graph. The locations of interest are listed, and the criteria we use to select them are at the bottom of the slide. That is, border district, have livestock activity, having rainforest or forested, might have had a Lassa fever outbreak, Ebola, or even COVID-19. Any location of these are the ones that we selected for this study. I'll now share with you the socioecology, some results from socioecology work. So this is a slide for socioecology. You can see a surveyor doing data collection in one of the border communities. And the view graphs here show images of training done on socioecology and also data collection being done for socioecology. And our teams, you can see are gender equal, fair representation of male and female participants in data collection. Early results here show in the pie chart, 84% of a sample size of 5,762 indicated that during outbreaks that there is an average reduction in household income in these communities. And you can also see the livestock activities in the households in these communities where we did data collection are higher before outbreaks, but lower after outbreaks, indicating also some of the effect of outbreaks on livestock activities in these communities. And when you look further here, in this other slide, with a sample size of 1,679, you see that livestock feed during outbreaks is decreased as reported by household members at 7%. And on the slide on the right, we also see that 57% indicate that it is not easy to get commercial feed for livestock in these communities. For gender-based violence during outbreaks, this is more important because of the lockdowns imposed during outbreaks, because of the district lockdowns and curfews imposed during outbreaks. We see that this tends to also increase gender-based violence. And our results show that there were gender-based violence activities in the communities where we did our data collection, as you can see on the slide. And also interruption of healthcare services for a sample size of 5,762 in Sierra Leone. Of course, you can see that immunization coverage is reported to have been affected, bed net distribution, treatment for malaria, HIV services, reproductive health services, family planning, antenatal care. All of these services were interrupted during outbreaks in Sierra Leone, as indicated on the slide from the communities who did our data collections. I'm now showing you here the Community Action Network composition. This is one of our work packages. So community action networks, each community along the border communities are formed into groups we call community action groups. And these community action groups are formed based on the criteria you are seeing: community leaders or influencers, community health workers, environmental health workers, traditional birth attendants, religious leaders, women leaders, local NGO rep. And as you can see on the slide, and you can see somebody organizing the community, and you can see the type of groups we are talking about. Text from the community action groups that are generated are now synchronized into artificial intelligence application called InfraNodus. So InfraNodus does the bit of analyzing and visualizing the text that are harvested in the WhatsApp groups formed for community action networks. This now here is the One Health Wheel of Change. So in this One Health Wheel of Change, you see that community action networks data from them feeds, ecosystem data feeds, pathogen surveillance data feeds, artificial intelligence data feeds, geographical information system. All of these feed into the Wheel of Change. Analysis are done. We have qualitative and quantitative components, and the output from all of this is what we have in the form of policy briefs at regional levels, even within the West African region, and we have enhanced One Health participatory action at community levels, and better knowledge of preventing and mitigating outbreaks. I thank you all on behalf of the consortium, and we hope that this research will move forward very nicely. We thank you very much.